My name is Dr. Saeed Ahmed, and I'm very happy to be here. And thank you very much, all of you, for arranging and coming to this great event. I am myself a medical epidemiologist, and my project, by virtue of this shift funding, is strengthening biosafety and biosecurity in Liberia through landscape assessment. Liberia is a country of about 5.5 million in West Africa, and it is a low-income country, so resource constraint is everywhere in health sector and beyond. Quickly coming to the health and global health security profile of Liberia. International health regulations, which is a legal document which is signed by all the member countries of UN, including Liberia. There are 15 core capacities in IHR, and every year they are actually scored according to their average. And you can see on the screen that Liberia is far below satisfactory, and it stands at 48% among all 15 core capacities. So average score of Liberia is 48%, as compared to the African region countries, which is 50%, and global average is 64%. So it clearly indicates that Liberia is lagging behind in certain core capacities which aim to detect, prevent, and respond to public health threats. This is another pictorial view of all these 15 core capacities, and the red arrow indicates the point of interest, which is laboratory, and it actually includes biosafety and biosecurity. So Liberia is performing far below satisfactory in this area as well. Apart from the one I mentioned, the other thing is joint external evaluation. This is a tool which is developed by WHO, and all the member countries actually conduct their assessment along with WHO and external experts, including US CDC and others. So Liberia conducted it last time in 2023, and it was the second assessment of Liberia's health system. And the results were actually appalling. It shows that the Liberia's capacity in biosafety and biosecurity is 0. When I say 0, the score is 1, but one score, as red color indicates on the left side, on the left side you can see the scoring. It starts from 1 and it goes up till 5. If any country has even no capacity, it gets the score 1, but it is labeled as red. And on the right side of the screen, you can see that Liberia, in biosafety and biosecurity in particular, it has no capacity at all. So score is 1. And there are two further sub-indicators. One is P7.1 and other is P7.2. So one says that whole of government system of biosafety and biosecurity is there in 3 areas. One is human health, other is animal health, and third is environment. And the second subset of it says that training and practices in biosafety and biosecurity exist. But in case of Liberia, unfortunately, both of them do not exist. So business case is very clear. So challenge is that Liberia scores a score of 1, which means no capacity in biosafety and biosecurity. And the blind spot is that there is no national inventory of dangerous pathogens. So government doesn't know where high sequence biological agents are stored and how secure they are. So if they are accidentally released or if someone is infected because of that, there is no such inventory or mechanisms in place. And the silo is that biosafety data is stuck on paper and it is disconnected from National Surveillance and Reporting System, which is DHIS2, District Health Information System 2. So system of data reporting is there, but it is not connected to the biosafety and biosecurity piece. So that is why they are working in silos. So what is the risk? So without visibility, a lab leak or theft could go undetected until it triggers an epidemic. So that is actually the risk. What is the solution? In the given circumstances, through this funding, I have proposed a solution, again, in consultation with the National Public Health Institute of Liberia, which is the executive arm working under Ministry of Health. The solution is that there should be a thorough assessment of the landscape of biosecurity in Liberia, and a matrix should be developed. So this through this rapid 4-month scoping initiative, I, with my team, is going to create a safety-first immune system for Liberia's public health network, and we are moving beyond the the static checklist to build a resilient, sustainable, and integrated biosafety and biosecurity system in Liberia. And what we are doing is that we are actually following the standard WHO Laboratory Biosafety Manual 4 for the risk assessment of the National Reference Lab at Monrovia, Liberia, because Liberia has a central structure and it has a national reference lab in Monrovia, its capital, but it has actually 2 regional labs as well in remote areas of the country, but they are not that much activated as NRL itself is. So Bridge is that a decentralized digital pilot through this funding, which links the peripheral labs and data from National Reference Lab to the national grid for coordinated public health response. This slide is very interesting. I was thinking before making this slide that if someone asks me, like a layperson asks me what I'm doing in Liberia, so I think this slide is the one which is going to explain what actually I'm going to do. I'm going to do that biosafety and biosecurity is actually revolves around 3 things. One is lab, other is epi, which is epidemiology, and third is data. So biosafety and biosecurity is actually pivoted around these 3 pillars. So what I'm going to do, through this grant, I'm going to interconnect the silos between lab, epi, and data to strengthen biosafety and biosecurity. And on the right side, if you see, it has a cause and effect relationship with One Health, which is now the standard practice of managing the public health threat. And One Health says that there are 3 components which actually health is based upon. One is human health, other is animal health, and third is environment itself. So these 3 components interact with one another, and that's how actually all the viruses and bacteria of epidemic potential, they actually interact with. So they are not actually localized to human beings themselves. They are actually a part of animals and environment. So One Health and biosafety and biosecurity, they are actually intertwined together. So through this funding, I'm going to establish that One Health and biosecurity, they actually complement each other, and we have to actually focus upon both at the same time. And on the sides, you can see that all these components perfectly fit into defensive, decentralized, differential, and democratic, which is actually the philosophy of DIAC as well. So they actually fall into that pyramid as well. I will not go into the detail, but that's how I have tried to explain how alignment with Shift 4Ds is perfectly aligning with my project as well. Why me? Why myself? So this is some nice words which Director General of National Institute of Public Health in Liberia has put for me, because I'm actually building upon this work on my previous work with Liberia, which was evaluation of integrated disease surveillance and response system. And so this is some of the testimonial which he actually wrote in favor of my work, which I actually done with Liberia previously. So my current work is actually is building upon the existing work which I already have done. So these are few of the project activities and that status. Some of the activities have been completed from the kickoff and developing the protocols, conducting the assessment, but some have been initiated only. As on number 5, you can see we are actually in the process of building the offline first reporting tool, which will develop the API mapping to link the lab data directly to the DHIS2 tracker. So that's how actually, any pandemic or epidemic potential occurring in the lab will directly be reported to the epidemiological side, the people who are actually responsible for response. So that's how that interconnectedness will really help to strengthen biosafety and biosecurity in Liberia. These are the detail of some of the other activities which are either completed or they are pending or they have yet to be started. Lastly, I would like to say that there are few enablers and barriers which I am going to have in this project. First of all, best thing is that government ownership is there, and then there is a high-level decision-making forum, NEPRC, which is National Epidemic Pandemic Response Committee, which is already there. DHIS2 platform is already there, and post-Ebola awareness and resilience is already there, because Liberia was hard hit by Ebola, and so in the current time, Mpox has also been there in Liberia. So pandemics and epidemics are nothing new for Liberia, but actually our focus is that they actually not try to keep on affecting the people and the mortality rate, which was very high in times of Ebola as well. On the right side, you can see there are certain barriers such as legal void, one health silos, culture of silence is there. People don't like to talk about the weaknesses of the system, and the sustainability, and of course persecution. The fear of persecution is also there, and sustainability and financing gap. This is something which this funding is trying to fill some of it, but still remains gaps remain over there, and capacity building is underfunded and less prioritized. So these are very quickly some of the visuals from the field. This is a team who is working along with myself on this project. They are mostly from National Public Health Institute of Liberia. And this is an EPRC meeting, which is in progress, and I have been part of that. And these are some of the kickoff meetings with the field staff and conducting and executing this project.